So there are a couple of different ways that you look at tremor. The first one is rest tremor. And remember, we've been observing during the entire exam to see any tremor, but you actually want to get the patient's hands in a better position. And that's sort of on the side where they're relaxing their hands a little bit more. The reason for that is that they can actually do things to suppress the tremor by the positioning of their hands, where they can hold their hands, put their hands on their lap, even sit on their hands, and you might not see tremor. But we'd want to just observe here while we're talking to him or doing other parts of the history or the exam to see whether or not we get any rest tremor. We basically would see a small movement in the thumb or in the fingers, or a rotational movement might come out while we're in this position. But this is a good position to look for hand tremor in. The next thing we want to do is look for postural tremor. And the way we do that is we have the patient put the hands in front of their body like this, spread their fingers wide, and hold them up there for a few minutes. Postural tremor doesn't always come out immediately. Sometimes it reemerges when the hands have been out for a few seconds. The third maneuver we do is action or kinetic tremor. And this is looking for tremor during the continuous movement. And we use finger, nose, finger most typically for this one. So to look for kinetic tremor, I'm going to have Larry take his index finger and touch my finger, and then touch his nose, and then touch my finger, and nose, finger, nose, finger, nose. Go ahead, you can relax. So a couple things there. I'm having him reach his hand completely out because that will bring the tremor out more. I'm keeping my hand in a fixed position, so I'm not trying to see whether he can touch it in space. That's more of an ataxia part of the exam. What I'm really just focusing here on is tremor. I also need him to go slow enough that I can actually see the tremor, so I'm not trying to have him go as fast as possible. You might actually miss the tremor if you have the patient go too fast. So when we're doing the kinetic tremor, let's go ahead and do it one more time. With your left hand, touch my finger, nose. This is how we do it for the Parkinson's exam to see the kinetic tremor.